5 years after the Sandy Hook massacre, efforts to improve mental health care for young people have had mixed results. Many reforms included in key piece of federal legislation remain unfunded. December 13, Hartford, Con. AP, anguished mothers with mentally ill children have sought out Liza Long for help ever since she wrote an essay, I Am Adam Lanza's Mother, comparing experiences with her son to the emotionally troubled 20-year-old who carried out the Sandy Hook Elementary School shooting. The massacre sounded alarms nationally about gaps in mental health care and led to calls for better screening and services, especially for young people showing a propensity for violence, but some key reforms enacted in the wake of the Sandy Hook shooting depend on funding that has yet to be delivered by Congress. And Long still hears almost daily from families overwhelmed by their children's behaviors and struggling to get treatment. We're still not seeing the access to mental health care, said Long, an Idaho mother of 4 and community college instructor who credited her essay with attracting the attention of a physician who correctly diagnosed and treated her then 13-year-old son for bipolar disorder. Like other mass shootings before and since, the tragedy prompted calls for tighter controls on guns and improved mental health treatment, but 5 years later, mental health care providers are waiting for promised boosts in funding and many families are still battling insurance companies to cover their children's services. While advocates say the quality of mental health care varies widely by state, they also see reason for optimism in a push for more early intervention programs and changing public attitudes about mental illness. There's a lot of reason to feel optimistic, said Ron Honberg, Senior Policy Advisor at the National Alliance on Mental Illness. But there are a lot of challenges too, particularly around financing these services. The 21st Century Cures Act, which was signed into law by then-President Barack Obama in December 2016, was inspired in part by the tragedy and included what proponents touted as the first major mental health reform package in nearly a decade. The measures that were included in the law but still await funding include grants for intensive early intervention for infants and young children showing signs of mental illness. Caption close. There were a lot of things people took credit for passing, said U.S. Rep. Elizabeth Esty, a Democrat whose district includes Newtown. If they're not funded, it's a nice piece of paper and something hanging on some bogus wall, but it's not going to help save lives. Mental health experts point out the vast majority of people diagnosed with psychiatric disorders do not commit violent crimes, and no motive has ever been determined for the December 14, 2012, massacre in which Lanza gunned down 20 children and 6 educators after fatally shooting his mother at home. A report by the Connecticut Child Advocate noted that Lanza's mother rejected recommendations that her son be medicated and get treatment for anxiety and other conditions, but it concluded his actions were not directly caused by his psychiatric problems. Rather, it said, his severe and deteriorating internalized mental health problems, when combined with a preoccupation with violence and access to deadly weapons, proved a recipe for mass murder.